My name is Megan and I am from Iowa Central Community College. We would like to welcome you to the Iowa Intermediary Network, a Vet for All from Big to Small event. My co-host is here with me today. Her name is Colleen and she's also from Iowa Central. We wanted to let you know that this will be recorded. And also, please, if you have questions, drop them in the Q&A and we'll make sure to answer them. We're excited that you joined us today. Today, we're going to learn from 3 local veterinarian experts. So let's get started. I'm going to let them introduce themselves now. We will start with you, Dr. Lee.
Well, thank you. It's so great to be here. My name is Dr. Molly Lee, and I'm a veterinarian at the Iowa State University College of Veterinary Medicine. I do, as we'll learn a little bit later in the webinar, kind of a little bit different work here at the veterinary school than our other panelists will. But really happy to be here today.
Thank you. All right, Dr. Shuey.
Hey, I'm Dr. Ryan Shuey. I am from Southwest Iowa, and I am a mixed animal veterinarian here. We've got 4 locations, but just a mixed animal veterinarian.
Thank you. All right, and Dr. Smith.
Hi, everybody. My name is Dr. Abby Smith, and I am a mixed animal veterinarian at 2 clinics in East Central Iowa.
Thank you all very much. All right, so let's get started. The first question is for Dr. Smith. How does animal care differ between large animals and small animals?
So that's a good question. As someone who works with both large and small animals, obviously the biggest difference is the size. And so at our clinics, we see all of our small animal patients in the clinic, probably similar to a lot of you when you take your pets to the vet clinic. We see them for general vaccines, any sort of limping, if they have heart problems, if they've eaten something they're not supposed to, anything like that. Where that's also where we do a lot of our surgeries. We do a lot of spays and neuters. If they have eaten something that they're not supposed to and it's stuck in there, we always have a good time going in there after it. And then with our large animal patients at our clinic, we do all of our large animal stuff on farm. And with our cattle clients, we'll do vaccines for the herd, preg checking, pulling calves, anything like that. This time of year is pretty deep into calving, so we're having a lot of that right now. We also see a lot of sheep and goats as well, and we see them for similar things that we do with our cattle. At our clinic, I'm primarily the one that does a lot of our horse patients, and we'll see them for vaccines, lamenesses, any teeth issues, ultrasounds, anything like that. And then every once in a while, we'll get some other oddballs in there, like some llamas or some alpacas. And those are always a fun thing to treat and kind of a fun little mix up in our days. As far as what we do with all of them, we'll do basic surgeries with our large animal patients, C-sections, things like that. We do a lot of health papers for the summertime for kids that will show their livestock. And a lot of times when there's big differences when we are in the clinic versus on farm. In the clinic, we obviously have access to a lot more materials and medications and tools than what we would have on our vet trucks when we're on a large animal call. So some of that takes a little bit of ingenuity, trying to figure out what we can use on the farm if things kind of go not as planned. So that's kind of our basic difference between large and small animal. I'm sure the other doctors can share some of their experiences with it too.
I have a question. When you said you did ultrasounds, do you do that in the office? Like when you have the large animals? I mean, do you have it, or is it a portable one that you take with you? I was just curious about that, and maybe somebody else was too.
At our clinic, we have multiple ultrasounds because there's 3 of us doctors here, and we with small animals, we use the same ultrasound for everybody. We just have different probes that we'll use on the end of it, depending on the size of the patient. So we have some small animal ones, and then we have large animal ones that we'll use either for cattle or for horses, have little different ones. A lot of times what we'll see here in the clinic is our small animal patients will ultrasound to see if we can find whatever we're looking for. And then at one of our locations, we do have horse stocks, and so we'll ultrasound some mares in there, and so we will see them as patients in there, but it's usually just one or two at a time and not several like it would be with cattle.
Thank you very much, Dr. Smith. Our next question is for Dr. Shuey. So we know that you're just going to laugh at this question. There isn't a typical day in a vet clinic or in any job, but I'm sure in your clinic there isn't a typical day. But can you give us an idea of what a typical day or what a routine day would be for you? And I know from experience that you have emergencies because you missed one of our calls because of an emergency. So I'm curious to see how you're going to answer this for us today.
I am very lucky if a typical day, the job starts at 8 a.m. and I'm home at 5 o'clock. So especially during calving season, animals don't know that a clinic is only open from 8 to 5. And so with emergency services, it can be anytime, day or night. And where on the human side, they have an emergency room to go to, animals don't have that. And so that's where the veterinarian, you're very much the front line and only line available for help for them. And so last night I was on call and I had a sick puppy come in at 9 o'clock at night. And then I had a cat that came in that couldn't pee at midnight. And, they need treated right away. And so sometimes that means a little less sleep, but it also is a very rewarding profession. The other thing too, with being in a small town veterinarian is you literally you don't know what's going to come in each day. So there's always your routine appointments, but vaccinations and just quick sick exams. But when you're the only veterinary clinic, sometimes you do have to you have to see stuff that you're also not comfortable with and adapt, like what Dr. Smith said. And so if someone has a sick gecko, all of a sudden I have to, they call me because I'm vet. And so it's very much, you never know what you're going to see. And it's if you don't want to do the same thing every day, this is a great profession for you.
Thank you. That was very interesting. All right, the next question is for Dr. Lee. All right, what is the outlook for this career, and are there emerging career areas in veterinary medicine that students could consider?
Yeah, great question. So the outlook for being a veterinarian is good. There seems to always be a demand. It will depend a lot on what area of veterinary medicine you want to go into. For example, sometimes there might be a lot of small animal veterinarians in a city or in a certain city, but a great need for veterinarians to do, for example, large animal or food animal work somewhere out in the country. So it does depend on where location-wise and interest-wise and specifically what you want to do. But in general, I think the career outlook for being a veterinarian is very good. It's likely that you'll be able to find work somewhere as a graduate veterinarian. As far as emerging career areas, there are a lot of different things you can do with this degree. So there are many of a lot of specialists. So if you think about all the different doctors that you might go see a human doctor for, a cardiologist, a dermatologist, a radiologist, we have these in veterinary medicine too. So that's one thing at the veterinary school that relates to that. So you can, after you graduate, choose to specialize in one of these areas, usually that requires some additional schooling beyond vet school, and an internship and a residency, kind of like human doctors. Some different areas too are being those teachers at the vet school. So you need someone to instruct the veterinary students. Usually they have to have some kind of specialized experience. So, when you're in vet school, you learn a lot about normal animal health, and then you learn about the abnormal animal health. And so you have to have someone teach you who knows a lot about those things, and that could be one different area. Another emerging area, which is an area that I'm involved in, is public health. So you normally think of your veterinarian working at your small animal practice or mixed or large animal practice like Dr. Ryan and Dr. Abby, but there are also veterinarians that kind of bridge the connection between human health and animal health, and we call those vets public health veterinarians. And so we have vets that work for the CDC or the Centers for Disease Control. Some of them work for the United States Department of Agriculture, the State Department of Agriculture. Really, veterinarians can work in a lot of different areas. And the kind of things that I do as a public health veterinarian in education are things like work on what we would do if there were a disease outbreak in our animals, not just necessarily, a small group of animals or a single herd, but what if a disease that we've never seen before in this country comes, how are we going to respond to it? What if it's a disease that can affect both humans and animals? We call those zoonotic diseases. And kind of do a lot of investigative work related to that. So that's one emerging area as well in veterinary medicine. But there are a lot of different types of places you can go and a lot of different ways you can use your veterinary degree.
How about research? Is that something that like just the different types of research? Is that part of what you could do as a veterinarian as well?
Yeah, you bet. There are a lot of veterinarians that do research, and a lot of that research benefits both animal health and sometimes human health too. So there are veterinarians that have come up with, different kinds of medicines that are used in both animal health and human health, different treatments for joints or bone problems, things like that. Some of those vets will work at a school or a college or a university. Some of them work for private industry, different companies. And again, some of them might work for the government too.
Thank you very much. Our next question is a combination of, and it's going to be for all of you, because I'd love to hear all of your responses. It's a combination of what we actually talked to you about when we were planning, but then we had a couple students ask us a question as well as about education. So what classes would you suggest a student who is interested in this career take in high school? How many years of study are required? And then we had a question about what is a vet tech and the education that person has. The question surrounded about what is the difference between a 2-year vet tech or one that has more years? We can start with any of you, Dr. Lee, if you want to continue, but please, the others join in on us and just kind of even maybe share your experiences, how you came up with what you wanted to do. Did you do something else, or how did you decide in your journey to get here? So I guess a big education, we always get this question. Thank you.
Yeah, I can start with the classes kind of education piece and then turn it over to my colleagues to help answer the other questions too. So in high school, one thing that's really important if you want to be a veterinarian is to have an interest in science. It's very science-based, and if you're strong in science and you like it, that's definitely an advantage. I took all the science classes that I could in high school. tried to get the best grades I could. When you actually apply to veterinary school, it's your college grades that they will look at the application. But your high school grades will help you get into a college that you want to. And so that's important as well. Another thing is that veterinary schools look at different prerequisites. So there isn't necessarily one major to complete before you get into vet school. Our most common majors from college are animal science and biology, but we've had English majors, mathematics majors, all kinds of different people come to vet school, and they bring a different strength. And so if that's your interest and that's your major, that's okay, but you do have to satisfy certain prerequisites in college. And so your advisor and the college advisor can help you with that as well once you get into college. But that would be my strongest recommendation, is really learn all you can about science. If your school has a vocational program or an ag tech type program, that could also be really beneficial to participate in, to get a little bit more information and experience with animals. Because in addition to the classwork, experience and hands-on work, shadowing or volunteering or working with animals or at a veterinary clinic is really important too.
I can handle the tech question a little bit. Within our clinic, they've got both, I guess what you would call registered technicians, and then also technicians that we've just directly hired. Your registered technicians, they are ones that have gone through a 2-year program, and that would have been, sometime after high school, completion of high school, they went and they got training specifically to assist the veterinarian. And registered technicians, they are ones that can perform dental procedures and learn how to place IV catheters, do blood draws, and just a little more just technical training on assisting a veterinarian versus I guess what you call our assistants or non-registered technicians. Those are ones that just got trained directly from the clinic, have an interest of working with animals or working with our clientele, and they there are some legal restrictions on what they cannot do compared to a registered technician, but in terms of assisting a veterinarian, they are a very vital part of a veterinary clinic and accomplishing the day-to-day tasks. So without both registered and not registered, a vet clinic is, a veterinarian's only as strong as his assistants. So.
I would add on to what Dr. Lee was saying about, I know schools that have FFA programs usually have like an animal science class or something like that in there. Those are good ones to take. As far as some more specific targeted classes towards veterinary medicine in school. So I would definitely recommend those. And then any kind of hands-on training that you can get either at a local clinic or any other type of event or organization or something where you have contact with veterinary medicine. And definitely don't be afraid when you take your own pets to the veterinarian or have the vet come out and see your livestock. If you have any, don't be afraid to ask them questions. I'm always willing to talk to people when there's people in the room, or if there's kids on farm that ask me questions about stuff. No question is too weird. I mean, we see some weird stuff as part of our job, so nothing really surprises us anymore.
Can any of you share how you decided to be a vet? I have students, I run the Career Academy for Iowa Central, and I have students all the time say, I kind of like animals, and they just really don't know what they want to be. And sometimes they think that they have to decide when they're, and they can't make changes. So I'm curious if any of you decided on something else and then decided to be a vet, or how you came about your journey, because that's something they always ask about.
I can jump on this one first. I I was one who growing up, my father was a veterinarian. And so I grew up where I did not want to be a veterinarian. So I saw how, it was cold. He was outside. He was working with large animals that were hard on his body. And so I wanted to be a human doctor because, I get paid 3 times as much and I can work inside. And so I actually went into college thinking I was going to be a human doctor. And after 2 years of going through undergrad, I realized that I faint with human blood. And so obviously that's not very good if you're going to be a human doctor and you pass out all the time. So I had to make a major, shift in what I wanted to do. I know that I really liked the caring aspect of healthcare. And I really liked working with people because veterinary medicine, yes, you're working with animals, but you're also working with their owners. Pets and livestock too are very much part of people's family. And so I like the work that it takes within your head to work through a case and work through a sick animal and try and make that animal better, but it's also helping that owner. And I really like that. And so that's where I realized, it might not be so bad to be a vet. So.
And I can add on to that. I knew since I was a little kid that I wanted to be a veterinarian, like a lot of my colleagues, but throughout the time of wanting to be a vet and becoming a vet and changing jobs, I have changed within veterinary medicine quite a bit. So when I was a kid, I thought I wanted to be a companion animal vet. I thought I wanted to take care of dogs and cats. I had pets and I loved them, and that's what I wanted to do. And then I started getting interested in horses. So then I thought I wanted to be a horse vet. At one point, I wanted specifically to be equine chiropractor. And then as I got into college and got some more experience with livestock, I wanted to be, a dairy vet, and then a pig vet, and then a beef cattle vet. Eventually in vet school, I just said I should probably just be a mixed animal vet so I can kind of encompass all of that. So that's what I did for, a little over a year after I graduated. I was a mixed animal vet. But when I was in vet school, I had a job working in the vet school group, actually where I'm at right now, the Center for Food Security and Public Health. And I kept thinking about that and how much I liked it and how it's a really nice kind of connection between humans and animals, similar to what Dr. Ryan was saying, but taking a little bit different approach to that. So like I mentioned before, there's so many different areas you can go into. You can be a clinical practice vet. You can do teaching, research, public health, regulatory medicine. There's even vets in the military. So it's really a very diverse career. And if you aren't sure exactly what you want to do, but you keep coming back to wanting to work with animals in a medical and scientific kind of way, then veterinary medicine might be a good career choice for you. And just know that there's a lot of different options within this career you can do.
I'll kind of add on to what Dr. Lee was talking about. I also wanted to be a veterinarian ever since I can remember. I always looked up to our local vet that we went to, and we had some close family friends that were also vets as well that had a pretty big influence on my decision. I, again, like Dr. Lee, I went into vet school and thinking that I wanted to be an equine surgeon and do sports medicine. I ended up shadowing some places that did that while I was in vet school and learned that that was not the path I wanted to go down for various reasons. And then was very, very fortunate to have found the clinic that I am at now, where it is a small town mixed practice in 2 very small towns that are very close-knit community where everybody knows everybody. So that's kind of an interesting turn from where I thought I was going to go to where I am now, and I could not be happier with my decision.
Thank you all very much. a question that just came into us. I want to ask, maybe one of you can answer or a couple of you here, but it talks about when you have to, put a pet down or if you get into a bad situation, how do you self-care? So if one of you feels comfortable, how does that not affect you forever? How do you not take that home with you?
That's a really good question, and it's a pretty common reason that a lot of people think that they don't want to be a veterinarian is because they don't think that they can handle it. It does weigh on you. It definitely does. The point of view that I take on it is a lot of times when we are performing that euthanasia is that we are able to end the suffering of the animal. And that's the part that helps me sleep at night, is that we have the ability to end the suffering, whereas other professions don't.
And I know a lot of veterinarians, or probably almost all veterinarians, are like this, where they don't do convenience euthanasias. And so this is very much what Dr. Smith said. We are doing what's most humane for that animal. And so something that's a very painful or chronic condition that animal is truly, their body's still going, but they're suffering. And so we're making it so that they are very much at peace, and it's tough, but it's definitely something that you have to look at. We're doing what's for the greater good of that animal.
Well, as I look at the clock, we are getting down to the end of our time here. And so I want to thank our panelists for participating, and to all of you out there that have tuned in. Instructors that are on today, you received an assessment that you can use for a class project or assignment. You use ONET to look up various careers for veterinarians. Tomorrow, you'll all receive an email for a survey, and we really would appreciate you completing that. We are being very successful on offering these different events, and your responses are what really do trigger what we look for, what we do as an live event. Next week, you will receive a link for this webinar, as well as a video that Dr. Smith put together for her clinic. It's really interesting. It's a tour of the clinic. And so you'll be able to actually, for those of you that are unsure, she does explain different things about the small animals and the large animals. So we do appreciate that very much. And I need to put in the link, but Megan, can you go ahead? Do you have the link, or I go ahead and do it? I meant to do it and I got enthralled in what they were saying. Megan is going to put a link in the chat for our website, the Iowa Intermediary Network. And if you want to see past events, you can go there. Or if you want to see what's coming up in the future, please go and enroll for these. We thank you again, and thank you for joining us today, and have a great day.